All right, January 21st, 2026. Welcome, welcome. Hello, Dr. Myrna. Oh, we've got a few other guests joining. Dr. Rima, Kevin, Jacqueline. Welcome, welcome, welcome. Dr. Sony, we've got a quick question from, I think, Dr. Sunny. At what age do you start using TADS for expansion?
So, skeletal anchorage can be used generally in the permanent dentition. Um, Historically, while there is primary or mixed dentition, the um, anchorage is usually on the teeth, utilizing either the primary molars or the 6-year-old molars. When we are in a mature form, after the teenage years start, so 13-year-old canines through, 12-year-old molars through, we get hardening of the structures, and we find it a lot more difficult to create change. So orthodontists will tend to bond to the molar teeth in the first 12 years probably of life. And then from the teenage years onwards, and especially in adults, which is where TADs were primarily designed for adult expansion. So the treatment that I do tends to be limited to preteens. So I don't personally use TADs for expansion, but that's mostly because I treat in the primary and the mixed dentition.
All right, yeah. So if you've joined us, welcome. Please submit your questions in the webinar chat or in the Q&A box in the middle of your Zoom panel. I know some of you have joined us from the November event. Welcome. You've got the access to the recordings. I know some of you did not complete, and you know who you are because we've got the records of some were able to just attend day one and miss day two. You got access to the recordings until the end of June. Now, if any of you have misplaced your password, please contact me at info@straightteethnaturally. I'm not going to name names, but I know I can see a list of folks who joined us, and our team have sent me reports on whether you've had a chance to watch the recordings or not. And some of you haven't logged in yet. And if you haven't logged in, feel free to contact us and we will set up an onboarding Zoom to help you access the Teachable platform because it'd be a pity not to complete the 2-day program, 14 hours plus additional Q&A, bonus Q&A sessions that we've added in there. Any other questions? We're here weekly. Okay, another question. Thank you, Dr. Kana. One second. Paste it in there. Simon. There you go.
Um, so I think recently there has been expansion aligners that Invisalign and some of the other manufacturers have introduced. I don't know much about that, to be honest. I'm assuming the tray system is still the same, but possibly covering the palate as well, and the I'm not sure if there's a screw in the center. I'm just assuming that each aligner is slightly larger and has a transverse component to it. So I don't really know much about that. Um, I don't use aligners in the primary or the mixed dentition, only the adult dentition. I don't often even use aligners for teens, even though there's a teen Invisalign teen. But yeah, so I can't say I know too much about that. I have a focus on primary and mixed dentition, and the stage 1 expansion appliance that we use in postural orthodontics works very, very well. It's very predictable and is the appliance of choice for myself and what I teach. So I haven't explored expanding aligners because our protocols are very successful with the existing appliances that we've created.
All right, terrific. So yeah, try to keep within the scope of our course material, which is intervention postural orthodontics. I've shared the link. If you forgot your password, not sure how to log into the Teachable platform where we uploaded all the recordings of our 2-day event from last November or previous events we've done that you might have purchased the recordings to or attended the live stream. For those of you who joined in the November event, you've got access to the recordings until June. So sent the Google Doc explanation, has all the step-by-step on how to re-log in and reset your password if you've misplaced it. Once again, you can either email me if you would like a Zoom call where we can share screen and show you step by step, or feel free to follow the instructions sent in that laid out in the Google Doc. Any other questions for Dr. Wong in relation to postural orthodontics, early interceptive postural orthodontics for the 10-year-olds? Right now, we have a few of you on. Any other questions from existing? We've got a new mentoring student. Kevin, you have any questions, Kevin? Want to break the ice for everyone? Jacqueline, past attendee. Myrna, I think you're a guest. Welcome. If you've got any questions about Dr. Wong's methods, if you would like to be hot seated and join the panel, you can raise your hand and ask questions on the Zoom rather than type it in. All right, next. Any other questions? Okay. People have asked when is our next 2-day event. We haven't set a date yet. So right now you can just get the 2-day intro recordings from our last 2 events. One was held at the Hilton. It was back in 2024. End of 2024 was a 2-day in-person event. We had Dr. Kevin Boyd as a guest speaker, orthodontist Amanda Wilson, ENT Professor Narinder Singh, and yeah, 3 main guest speakers who spoke for about an hour each, and then Simon spoke for about 10, 11 hours. So about a 14-hour event, 2 days. You can get access to those recordings and a similar event, but that was done purely on Zoom. Similar content, obviously different questions were asked. We had a different set of guest speakers from last November. So you can get access to all those recordings for just half price at the moment until the end of the month. 247 if you're a guest and like to learn more about Early Interceptive Postural Orthodontics. Here is the link. You can learn more about it. Okay, we've got another question here. Let me just paste it in. We provide weekly Q&A support, as you can see. Here you go, Simon. Next one.
So the question is, do we get expansion of bone in the lower or just tipping of the teeth? The answer is, depends on the age. So typically, as we work in primary dentition and mixed dentition, we've got a very large volume of dental alveolar bone relative to the basal bone underneath in the mandible. Because we also have large extensions to include acrylic that involves the roots of the primary teeth and the crowns of the forming permanent dentition. The movement tends to be quite upright in transverse. The whole alveolar process, which extends a significant depth in mixed dentition and primary dentition. So we get translation of that whole dental alveolar segment. So we don't get much tipping in younger children. This changes when you reach the second decade of life, where the roots of the primary teeth shrink through resorption, and the amount of dental alveolar bone relative to basal bone ratio decreases. And then you're much more limited to what kind of translation of that region is possible. So once we are no longer in permanent dentition, most of the movements are tipping related, and it's still effective in uprighting compensated curve of Wilson increases, which are very common when you have adaptation of mandibular teeth to try to intermesh with the narrow upper arch. But once you're in permanent dentition, very little in the way of transverse expansion of bone, more tipping. But of course, if the curve of Wilson is fairly flat to begin with, you've already got a good arch form, so you don't really need any form of expansion. When your curve of Wilson is steep, then tipping is suitable treatment anyway. So it's effectively based on the paper that Major produced on his CBCT assessment of the arch form in the mandible being more often than not compensated through excessive lingual tip or eye curves of Wilson. So typically uprighting teeth to level and align them is a normal process in even just using archway. So there's very little difference in that aspect. But again, as I said, our focus is on primary dentition and mixed dentition, and we get a lot of expansion in the dental alveolar arch bone, and because of the high volume of teeth internally developing, that depth of dental alveolar bone extends significantly. And our acrylic form of the stage 1 appliance captures all that. So you get a lot of arch form expansion that creates a much broader mandibular base to work with.
Okay, terrific. Any other questions? Um, Thank you. Thank you, Dr. Kana, for your questions. Any other questions? As you're thinking about it, I'm gonna mention how you can access our recordings. I've sent the Google Doc. I've sent you, some of you guys, a Calendly link. You can schedule a call with me, and I'll be more than happy to walk you through the process of logging into your recordings. All right. So what else do we have here? Allow multiple presenters to share. Only one presenter can share. All right, I'm gonna share my screen. Don't have any, see any questions coming up. So I'm gonna also mention how you can get access to our course. Simon, I'm gonna share my screen if I may. Can you see my screen, Simon? Yeah. So quick update. We our CE partner has renewed their license finally, so we can now offer a full 14 hours of CE verification via PACE AGD. So if you make a purchase now, in the past we couldn't offer it, unfortunately. So if you yeah, if you haven't completed the course, we didn't actually guarantee we would have such a CE. It was just going to be a certificate of completion, but here's another incentive for you to finish the course. If you do, you can get 14 hours of CE verification via PACE and AGD. And as mentioned, we've got a number of guest speakers, all the recordings from their presentations from back at our 2-day event at the Hilton in New Jersey. And people paid a couple of $1,000s to attend, and you can get the recordings for a tenth of the price, 247. And you get access to the recordings from our most recent November event last year, end of last year. So 10 more days are special. It's a New Year kind of special before it reverts back to the 497. It's only 247. So we're proud to partner with the Complete Health Group and Dr. Nazari. Big shout out for him and TMG Research Foundation and Yvonne for helping with all the logistics. There's a lot of things happen behind the scenes to get the PACE approval, Academy of General Dentistry. And you can see we renewed our license from August last year to 3.5 years, July 2029. Hopefully we'll all be around still then and AI hasn't replaced our jobs, which is unlikely for dentists, apparently. So that's a good thing. All right, Dr. Cheng has joined. Welcome from Malaysia. Some of our advanced students have joined. Yeah, if you've got any questions, we're here for another 20 minutes. I'm going to stop sharing. Just quick plug. We don't have any set time to do another 2-day event, but get the recordings. Some, about 70-80% of the people join because of, CE or just curiosity, but, 10-20% are interested in the advanced training, which we have. We've got mentoring programs, one-on-one. If you're a parent dentist wanting Simon to supervise your case for a few $100 a month, we can do that as well. You get access to training and so on and so forth. Anyway, so any questions before Simon gets back to work? He's in Melbourne, Australia. It's midday here, his time in down under. I know it's evening time here in the US where I'm based, and you guys as well. Malaysia is morning as well. Good morning, Dr. Cheng. How was the conference? I think you were at some sort of a conference with Dr. Koo. Any questions for Simon? He's got 20 more minutes. He can stay on, or we'll wrap up early if there's no other questions. But we're here to answer any questions in relation to early interceptive postural orthodontics. Anything interesting happening, Simon? Did you get a chance to go watch some tennis? Australian Open is on.
Just in passing.
Yeah.
With the CE credits, for
Mm-hmm.
those who attended the last 2-day introduction at the end of last year, um,
We
if they
didn't actually offer it, right? So theoretically, it's a lot of
if
it's
they redo the uh,
because we weren't
Q&A,
licensed back then. If you
no,
notice, yeah.
if they redo the quiz and get all the answers right, um,
Look, in reality, it costs us additional money to get a proper verification for each individual student.
oh, I see.
So for a
Okay.
nominal fee, maybe $20 if you want the eight, we didn't offer it. Normally it's our events are much more expensive if there is AGD CE because there's an expense to get it done. It's a th we work with a third party company, right? So
So from this year onwards, our courses will have
yes.
the
We have to pay a lot an annual fee to be their partner, and then on top of that,
yeah
um, there's additional fee
um,
per student that we have to
yeah.
pay,
Okay.
right?
So
So we can now offer it,
from
by the way, just FYI, I spoke to Yvonne today, not only for the
mhm,
2-day intro, but for our advanced training, there's 30 hours, right? For the four phase one, phase two, lab day, clinical day. So there's a 30 hours that can be um, we can give additional 30 hours there. And guess what? Our case study vault, right? Which our case study vault, which has hundreds of hours, but we've got a structured 70, right? Which is the first year of training that you offered. Remember the mentoring the first year of 2021? You taught and did case supervision. So long as they watch that systematically, we can give up to a certain amount of that. Yvonne has to double check for self-study. There's a limit. You can't just give like 70 hours. So that could be additional 30 hours. Make sense?
yeah. Plus, I don't know how we can structure questions for that.
I don't know whether
So
it's it's not, may not be critical
no, I
because,
think we'll have to limit it to the modules and the 2-day.
okay. I mean, yeah, I'm getting Yvonne to double check whether there has to be a quiz for that. And in answer to Myrna's question, Myrna, yes, there is a quiz for the CE. All right. So it's 36 questions, I think, for the 2-day and it's multiple choice. And the good thing is you only need to get 80 or 90% right. And if you for whatever reason don't pass the first time, we let you do it as many times as you want until you get to that 80% pass rate, which is, not too difficult. And then it takes like 10 minutes, right? Each time you do it. And then as soon as you complete it, you'll see the exact answers as well. All right. So it you can't just
Yeah, look, CE, you can't just buy CE. You
no, yeah.
actually have to study for the CE,
Yeah. You gotta there's two things. To get proper verification, you have to complete the 14 hours. And we have a tracking mechanism, right? So we know if you've watched that and clicked on, watch because the system with AI and everything, it tracks every minute you're on there, and then as soon as you finish, you got to click complete, move to the next video. there's like 26 videos on average, is like 20 or 30 minutes each video, right? There's 14 hours. And yeah, so you watch each video in sequence, right? And then there's a test for each. There's 2 days of training, like 36. I can't remember exactly how many questions. And then you just do the quiz. Once that's done, you email us, and we verify that you completed all 14 hours. And you've completed the test. And then because the system tracks everything, um, and then you can get the certificate of the CE verification. All right, hopefully that's a good question. So thank you for that. Thanks, Mona. Yeah, so Mona, I see I think are a guest, so welcome. Hopefully, yeah, check out the if you have any questions, if you want to get a better understanding of the entire program, feel free to email me. We can set up a time. More than happy. We've got obviously different websites. Sometimes it's easier just to give you a quick 10 or 15-minute overview of our, entire program. Some of you just want to do the 2-day program to get some CE, which is perfectly fine. It's a wonderful course, 14 hours and really interesting guest speakers covering this field, early interceptive postural orthodontics. Others, about 10-20%, will want to do the advanced training and mentoring. Right? Some of you want some hand holding. Simon, every 2 weeks, spends 5 or 6 hours. Kevin is joining us. Kevin, you want to do a shout out if you're still there? Kevin actually sat in and observed for 9 months, watching the supervision happen, and now is finally joining us. So, Kevin, you there? Want to say a few words for us if you're on right now? Feel free to. Uh, I'm going to click on allow to talk if you want to join us. I mean, if you're busy right now, not a problem. But Kevin, big shout out. He's got a new clinic that he's launching in Kentucky, Texas, if I'm not mistaken. So that's exciting. Pediatric um, clinic, and he'll be joining our mentoring program. So some of you just want one case. It could be your own child. So we have a very affordable mentoring program where you just want one case supervised, which is generally your child. And some of you will upgrade to higher levels where you want more time and more case supervision. You're submitting X-ray, Ceph analysis, photos, ortho panels, questions in advance, and Simon reviews dozens and dozens of cases over the weekend. Spending those 6 hours one-on-one with you for 40, anywhere up to 40, 50 minutes every 2 weeks. Some of you have one case, your child, and you might only need 20 or 30 minutes every month, right? As you're implementing this over the course of 12, 15, months sort of thing. All right. Any other questions about... Thanks, Dr. Sony. He's headed off. So we're going to another 10 more minutes. Any questions? Dr. Chang, you got any questions for Simon? I know you're one of our advanced students going through the program. I think your question was very valid about what happens if there's a few cases and you're not sure whether they're suitable. We actually, your colleague, Dr. Koo, actually will be doing a special consult just for 10 minutes and with Simon, and it's very affordable. Just spend 10 minutes for Simon. He's going to review the records, and if you need a few more minutes, then that's possible as well. So Simon will stay on and go through those cases to give quick feedback before you undertake it yourself or decide whether you want to join the mentoring program. So we mentioned, it could be guess, if Simon looks over the records, maybe in 5-6 minutes, he can give you some quick feedback on what classification it is, whether it's suitable for his treatment methodologies for early intervention. These are for mild to moderate cases, right? Not hyperdivergent and blah, blah, blah. And we have an application call, right? When you fill out, if you want to join the mentoring, you fill out 10 questions which explains your background experience, what courses you've done, and then that'll give Simon a better understanding of your skill set. Right? He's not going to say, yeah, go ahead and treat this, and you've got absolutely zero experience, or and if it's borderline moderate to whatever, he will give you some warnings, right? Anyway, so we're testing. Look at another question that's come in from Dr. Chang. Okay, what about screening the cases? Just the photos needed? Actually, I asked Simon that question, so I'm gonna tell you what he said. Give me a second, and Simon can correct me if I'm wrong. But what is needed for even for screening is the following. I'm gonna share it in the chat and read it. So actually, and this is yeah, so that's the answer. Pediatric sleep questionnaire. Which one? Simon has created one, and you've got that as part of the 2-day intro course, right? It's like, I don't know, 15 questions. Orthodontic photo panel. We all know what that is. PanX, OPG, lateral ceph, radiograph side. You know that can be a 2D X-ray or a large field CBCT for the X-rays if you prefer. So you need that for each child, right? And as I said, it's a really good question you brought up, because some people, what they're going to do is they may not want mentoring, but they want Simon's quick, hey, what classification it is? Is it a class 2 div 1? And then they can go to the case study vault, which is very affordable, effectively a couple $100 a month, and you can see dozens of examples there that are that particular classification. And you can go to the progress reports, go back to the archives of when that child was covered, right, and was mentored. Let me show you exactly what I mean, because a lot of this will give you a better sense of it. Here we go. So, for example, you can see this. You can see, we've got 10 different folders, right? Class 1 has 2 subfolders. Class 1 crowding, class 1 spacing. And then class 2, there's div 1, div 2, right? And then there's class 3 high angle, low angle, different open bite, skeletal, right? So different folders. And within each folder, we've got, just dozens of cases. I'll just showcase. I can actually, oh, showing some. So we uploaded over 500 cases that were submitted over 6 years into a folder. This is for the advanced students who've joined the Case Study Vault program. And as you can see, we've uploaded into a neat little folder. We call it Case Study Vault. Not only by week, but by classification, right? So let's say your child or your patient that you're most concerned about is a class 1 crowding, protrusion. Since 6 years ago, just in the last couple of months, you can see dozens of cases submitted, and some are ongoing progress reports. So let's say you pick one of them, a deep bite screen. Oh, this is a screening or something, and you can see this was presented back in May, and you can see for each case that is being mentored, there's a certain set of data that Simon wants you to fill out. You got the ortho panels, the ceph analysis, et cetera, right? And then the questions, the treatment plan, and because there's a date, and you can see the designs that Simon, has put together, the hand draws, and then you get a manufactured, and so on and so forth. So you can see this timestamp, right? And you know the date of when that happened, 17th of August, and you go to our 17th of August. Let's see here. Archives, right? There's this thing that we call Case Study Vault. All right. And then the 17th of August was last year. My goodness. What, Sunday? All right. And then we upload the entire, 3 hours that it was 2 tracks. There's a Saturday and a Sunday, 2
That
tracks on the
makes
weekend.
sure patients are anonymized.
There you go.
More
Right.
privacy laws.
Right. So you can see Simon mentoring on that. It just so happens, I think I picked the Deep Bite Screening Austin. That's the one. What a coincidence. That was a bit of a fluke. Anyway, so you get the drift. You can see there's like 3 hours here of mentoring, right? There was probably four students that came on at different times, submitting their cases for direct supervision, right? And then so you don't have to be a full paid mentoring student. You can just get a quick assessment from Simon. Might take him 5 minutes, 10 minutes, or we're going to test it out and see how long it takes just to get A, is it suitable for postural orthodontic methods, and what classification is it? Another quick question. I would like to do the screening case vault first before deciding about mentorship. Simon's lecture is very extensive and detailed. I would like to do self-study first. Perfect. I mean, that is why we have the case study vault, right? It's for you to first study, and that's what Kevin White did. He's not quite here, just logged in. He spent 9 months observing, studying the case study vault, because we literally have 300, 500, I've lost count, cases submitted. Not all of them were completed, obviously. Some were just submitted for screening. Some of them were completed over a year, 2 years, whatever, right? And then at some point, you can consider joining different levels of mentorship. Some people only want 20 minutes a month. Some people want, 80, 90, 100 minutes a month of Simon's time, right? So we charge like a lawyer per minute, and that's the simplest and most equitable way of doing the mentorship. Time is the most valuable thing we have on earth at this stage with limited time in our busy lives. So that's how we do it. But with internet, we can literally archive hundreds of cases, and you can learn through. The best way to learn is through case studies, right? Harvard case studies, etc. Any questions? We're going to wrap up in 2 or 3 minutes. Thanks for those questions. Some of it's for those who are advanced students, obviously. Any other questions from guests or anyone? Yeah, so Dr. Cheng, if you
All
want
right,
to
thanks, guys.
do the
I'm
screening
gonna head
case,
off.
just contact me. Yep. All right, let Simon go. Thank you, Simon. Have a good one. Good night, folks. Bye.